The other thing when I'm back here is if you hear the noise, I'm sometimes trying to grab your attention inside. Whatever you're ready.
Good afternoon, everyone. My name is Slemons, and today I will be discussing how shoulder rehabilitation can be more effective. A little bit of background needed before performing shoulder rehabilitation is the bony anatomy and musculature involved in the shoulder joint. First is the shoulder girdle, which consists of the scapula, the humerus, and the glenohumeral joint. This is common in labral tear injuries and is the structure that's involved with that. Also, another bony anatomy is the acromioclavicular joint, which is the acromion of the scapula and the clavicle. This is associated with AC joint separations and ligament sprains in the clavicle. Next is your scapula, which consists of the scapular spine, the inferior and superior angles, and medial lateral borders of the scapula. This structure is involved in scapular dyskinesia, which is an injury where the scapula does not move properly within the body when your arm is moving. Lastly is the humerus, which is the long bone in the upper arm. The most common injury in the humerus is a fracture. The two most common injuries in the shoulder are labral tears and rotator cuff tears. Rotator cuffs is four groups of muscles, such as the infraspinatus, supraspinatus, subscapularis, and teres minor. All muscular injuries are known as strains and can be graded 1 to 3. A grade 1 strain is a stretch of the muscle fiber. A grade 2 strain is a tear of a muscle fiber, and grade 3 is a full rupture of that muscle or the muscle tendon. Overall, this relates back to wellness because wellness is a state of being in good health and approach to living. Shoulder rehab, whether it be pre-surgery, post-surgery, or post-injury, helps the patient get back to good health and full health. Keeping up with rehab exercises after rehabilitation is finished can also help increase the approach to healthy living. Some of the injuries may not necessarily need a surgical option. However, with the labral tear and rotator cuff tears, it's more likely that the patient will need surgery to return to activities of daily living or the sport that they must play. The materials I will be using is comfortable clothing, which is preferably shorts and a tank top. You want the patient to be in a tank top so the clinician can examine the whole joint of the shoulder when assessing them. Also, I will be using TheraBands. There are 3 different colors, but in a later protocol, which I will be using for a labral tear, a blue color TheraBand is used for heavier tension. Next is an ankle cuff weight for the wrist, and it's a 5-pound weight. There are 1 to 10 pounds, and 5 pounds is the most common ankle weight that you will use with shoulder rehab. Next is a wall or doorway to perform wall slides. And lastly are hand weights, which is 10 pounds. And there's also a range of 1 to 10 pounds. 10 pounds is used in the later protocols, and 1 pound is used in the earlier protocol. The method I will be using is for a labral tear. However, this can also be used for rotator cuff tears because it targets the rotator cuff muscles as well. The patient will heat their shoulder for 15 minutes before exercise. They will then perform wall slides on the door frame or a wall, and they will do 3 sets of 10 of them, holding at their top end of range of motion for 30 seconds. Next, they will do 4-way shoulders with the blue TheraBand. They will do 3 sets of 15 of these each way. Lastly, they will perform I's, Y's, and T's of the shoulder using a 10-pound weight, stopping at 90 degrees, which is about shoulder height, and we'll be doing 3 sets of 15 as well. Now is the demo portion.
Welcome to the demo portion of my presentation. I will be talking about making shoulder rehabilitation more effective. When the patient first comes in to the athletic training facility or physical therapy clinic, you want them to heat their shoulder for approximately 15 minutes so the muscles, tendons, and ligaments loosen up within the joint so they get greater range of motion and it's easier for the clinician to work with them. They would come over to the hydrocollator, open the lid, grab close the sleeve, and place it on the affected shoulder. The first exercise we will be performing is wall slides using a towel. You can use a wall frame or a door frame. The patient will do 3 sets of 10 of these, holding for 30 seconds at the top end of their range of motion. The clinician is looking for any pain in the shoulder joint, the acromioclavicular joint, or the glenohumeral joint. They're also looking to see if they have full range of motion. If they have limited range of motion, the clinician will then instruct the patient to stop wherever they feel pain at their range of motion. If this is too easy, this is where one of my unique changes comes into play. My first unique change is adding a 5-pound ankle weight to the wrist of my patient. We will then continue to do wall slides with a towel. Adding the 5-pound weight makes this exercise harder, and it also targets muscular strength endurance as well as range of motion. The next exercise in shoulder rehabilitation is 4-way shoulders. There are 3 different TheraBand tensions that you can use: black, green, and blue. Green is the lightest tension, black is medium tension, and blue is the hardest tension. I'm using blue because this patient is further along in their rehab process. They would perform internal rotation, shoulder extension, shoulder external rotation, and shoulder flexion. This is targeting all of the rotator cuff muscles in the shoulder, which consists of the supraspinatus, infraspinatus, subscapularis, and teres minor. If there is a rotator cuff injury, this is used to help increase muscular strength. It's also used in labral tear injuries to help increase the capsule strength as well. The last exercise being performed in shoulder rehabilitation is I's, Y's, and T's of the shoulder. They will perform shoulder flexion, shoulder scaption, and shoulder abduction. They're using a 10-pound weight and will be doing 3 sets of 15. My second unique change is adding inferential current electrical stimulation and game-ready compression therapy after rehabilitation exercises are finished. My settings for IFC will be 80 to 150 megahertz to help target the whole shoulder joint and decrease pain. I'm also using the game-ready machine, which will be hooked up to a hose onto the sleeve to pump ice-cold water through the patient. This will help decrease any swelling in the area, along with pain that the patient may be having. I'm crossing the stim pads to target the whole shoulder joint, and then wrapping the game-ready sleeve around him.
The most vulnerable position you can put your shoulder in is external rotation and abduction, and this causes either a labral tear or a rotator cuff tear. Also, a rotator cuff tear is caused when you have excessive overhead lifting of a heavy weight or falling on an outstretched hand. The 2 unique changes that I have was adding a weight to the range of motion exercises with using the wall slides, and the second was electrical stimulation and game-ready compression therapy post-exercise. This helps target range of motion and manual muscle testing, which are 2 separate aspects in rehab. It also decreases the rehabilitation time frame to return the patient to activities of daily living, or if they're an athlete, the specific sport they play. Lastly, IFC, which is inferential current stimulation, and Game Ready help decrease pain and swelling within the shoulder joint. And this will help for the next day of rehab because the patient can be pushed harder because they have less pain and less swelling within the joint. 2 of the themes that I will be connecting them to are Foundations of Athletic Training and my psychology class. In Foundations of Athletic Training, we're taught the anatomy of the whole body, different injuries that can happen in the body, the treatment that is used, and the 5 domains of athletic training. One of the 5 domains is Domain 2, which is injury, illness, wellness prevention, and exam assessment and diagnosis. Exam assessment and diagnosis is very crucial to this part because if you are unable to examine a person and diagnose them with an injury, you don't know where to start for the rehab process. Next is Intro to Psychology, which is my social science. This, I looked at more of the mental aspect of life and how injuries can affect the mentality of a patient. Also, they can have a mental block in their rehab process and may not want to return to play. However, you want to still encourage them using cueing and imagery in the rehab process and state to them if they continue to do this, they can return to their sport quicker and return to their team as well. Overall, this relates to health psychology because the mentality of the patient throughout the rehab process needs to be increased so they have a better state of mind and a better state of being when they are going through it with their injury. Also, they may have less depression and less anxiety once they are back with their team after shoulder rehabilitation is finished. Lastly, adding weight and modalities can help improve the patient along the rehab process quicker so they can return to those activities of daily living sooner or their sports sooner as well. Continuing the exercises once rehab is finished will help decrease their likelihood of re-injury.